pain, back injuries, or back considerations, if you like. So if you're watching for you, or you're watching as a teacher, take note of all the little bits and pieces that I'm going to throw at you, because they might be relevant to other practices, other activities, other types of fitness that you're engaged with. So to start with, we're coming to standing. I'm going to face you for a moment just to talk about the feet. So in traditional yoga, you would line the outside edges of the feet up with the edges of the mat. Obviously, I'm not going to go this way, I'm just demonstrating. So in traditional yoga, outside edges of the feet in line with the edges of the mat. Now for me, and I think for a lot of other people, when I do that, it just sends my knees in towards each other. So if I relax here and I relax my legs, I can feel like my knees are pointing in. And what I really want to feel is that my knees are pointing forwards, because then when I bend my knees, they're not going to come together. So I'm going to change my feet slightly, so they're just turned very slightly out. Close my eyes. So now I feel as if my kneecaps are pointing forwards, and so when I bend them in a moment, they're definitely going forward. So I'm going to come to the end of the mat. And I'm going to position my feet very slightly in turn out and lengthen out through the crown of the head. So we're starting our Sun Salutation here in Tadasana, mountain pose. Hands pressed together, shoulders down, lengthen through the spinal column. And as you inhale, send the arms up. So if you're working with the back pain population, I wouldn't advise sending them into a back bend. Just lift the breastbone slightly. Then as you're breathing out, so you're going to bend your knees, take the arms back, so you're opening up the chest, and work on keeping the spine straight as you fold into your Uttanasana, your standing forward bend. Again, keeping the knees bent, lengthen through the spine, so you're not trying to extend, you're not putting any pressure on the lower back, you're just sending the breastbone forward, sliding the shoulders down, and then as you're breathing out, folding back in to place your hands down. From here, step back first of all with your right foot, and then stepping straight away with your left foot, so you're coming into a high plank, but then straight away place your knees on the ground and stretch out your feet. From here, watch closely. As you bend the elbows, you're trying to send the chest down, but the hips stay up. And from here, you're just allowing the body to stretch out and pull the elbows back as you come into upper back extension, keeping this area of your back really long, keeping the glutes switched on. Now, pushing with the hands, send your knees into the ground and lift the whole body up as one unit, as opposed to coming up into an extension and then pushing back from here. So hips up, push the hips back, and from here we're going into downward facing dog. Tuck the toes under and send the hips back. Again, we're talking about back considerations. So we're going to keep the knees bent, send the tailbone to the ceiling, keep the hands firmly planted. Stretch and lengthen through the spine, and you can hold it here for a few breaths. You can even just slightly bend one knee, stretch the back of the leg. So my knees are staying bent. Look at the space between your hands. Now if you've got somebody with a back problem, they may find this quite a challenge. So what you can do is just ask them to move the foot forward and then use the hand to move it forwards, manually, rather than kicking it forwards. And from here, driving through the right leg, lift up the back leg and pop it in underneath. Notice my knees are still bent. From here, again we're talking back pain, so you've got a choice. You can either ask them to roll one bone at a time and with consideration through the spine to come all the way up to standing, lifting the arm, lift the breastbone and come back into Tadasana. Or from here, if you have anybody who's got a history of disc curling is dropping the hips down and then using the support of the legs to come up with straight spine, straight back, straighten the legs.